So screening, when we talk about screening, it's truly not for somebody who's already felt a lump. There's an additional type of mammography for that, which instead of the 4 views of the breast, it's 8 views of the breast. And it's a totally different type of mammography for somebody who's already got a problem. What we're talking about, what we're doing through Making Strides, is truly driving women to get a screening mammography. So if they are age 40, they're going to get what's called their baseline. Their baseline is that first year screening mammography. And what makes mammography work, not only can you find something, a potential lump, but what makes mammography work is the year after year comparison to the baseline. Once someone's screened in baseline, they have multiple years that they're screened after, hopefully at the same facility, or at least getting their records transferred from facility to facility. Then the radiologist can look for the differences or the changes, and that is the first initial sign of breast cancer. So that's our goal with this organization and with our messaging through Making Strides Against Breast Cancer, is driving individuals for annual screening mammography with the hopes that they're going to catch that breast cancer if they're going to have it very early. So the Texas Breast Screening Project, what that showed us, and it actually set the stage for what you see everywhere now. It set the stage for any hospital, any mammography facility to do large-scale screenings. It proved scientifically that large-scale screenings for breast cancer work, and they're effective. And that was a significant piece. The American Cancer Society tackled that entire project. So now, when you see other organizations that are giving money for breast screening, that whole thing would never have been possible without the work that the American Cancer Society did. So now let's talk a little bit about, and of course now we moved into the digital mammography piece. So digital mammography is just put another layer on top of the normal mammography that the American Cancer Society supported. Now let's talk a little bit about why Making Strides Against Breast Cancer, why are we doing it in the Great West Division, and really what we're looking for as far as impact goes. One is I want to talk about our need. If we look at the Great West Division, right now 56.1% of women over the age of 40 are receiving that annual screening mammography that we're looking for. Just a little over half. We've got a huge job to do, especially if our job there is to work that 56.1%. We really need to make sure that we're getting the low-hanging fruit taken care of, working effectively in companies to spread that message and build those Making Strides teams to raise that awareness, to raise the money to support all the breast cancer initiatives. So that's one reason, as I mentioned, that we really call into companies, because truly, if we can get that message out to those who have insurance coverage, we've got a much better chance of getting on top of the disease. Another sad statistic for the Great West Division is that of our underinsured women, or uninsured women, uninsured, no insurance, underserved, 30.4% of those women are currently receiving annual screening mammography. As you can imagine, when you start working with that last 20 to 30% of the population, when I say the last, those are the hardest to get to. Those individuals who might not have the resources, who don't have the education, don't have the information, don't have the insurance coverage, it's almost 85% harder to reach the lowest 15% of the population with those aspects. So it takes a lot more resources to reach and to effectively get those individuals to be screened. So how the American Cancer Society approaches when it comes to the underinsured or uninsured population is that we truly utilize the impact of our advocacy program. By working with advocacy, we can truly support the funding of the BSEP program. So the BSEP program, the Breast Cancer and Cervical Cancer Early Detection Program, truly was put in place nationally, and there's two pieces to it primarily. There is the federal piece. So we advocate at the federal level for funds to be allocated to this BSEP program. Those funds offer screening mammography to women who qualify for that program, primarily uninsured, underserved. It offers funds to support the screening for those women. Then we also work with the state level, so two different pieces, federal advocacy and state advocacy. At the state level, we actually work with the state budgets as well to try to get them to allocate additional dollars to the federal money they're receiving to provide follow-up care, treatment, and additional screening, of course, for those women who qualify. So again, that's what the American Cancer Society does. That's our biggest opportunity to get the most dollars and the most support for the underserved populations and the uninsured populations. If you look at organizations if you look at, some people ask us, what do you do versus what does Komen do? And it's a great question. What we do is we kind of both fill the gaps that are needed out there in the breast cancer picture. Komen's primarily known right now for funding, of course, a piece of breast cancer research, so they're part of breast cancer research. The American Cancer Society actually funds more breast cancer research than Komen does, but not a big deal. We're partners in this thing. We both have the same goals. So what we're looking at, what Komen does is, Komen, if you'll notice, they are a foundation. The word foundation is after their name. They're required to grant out money. Foundations are required to give a certain amount of money out every year. That's what Komen does. That's how they were set up and what they were set up to do. So you'll see them doing a lot of granting to local hospitals and institutions to, one, provide screening, and they also do a lot to try to do their part for underserved. They truly try to work and maybe provide money for screening, say, in the African American population, in the Hispanic, Latino population. They provide niche funding as well. So they are doing their piece as well. But we truly own that advocacy piece to where we are the strongest organization with the biggest group of volunteers and the biggest group of voices that truly make the lawmakers listen to us and provide dollars for both of those resources. As you can imagine, it's important for us right now in this economy to truly work and really educate and raise that awareness, because getting money for the states to set aside and for the federal government to set aside out of already crunched budgets is getting harder and harder. So the more people we can get signed up for ACS CAN, the more people we can get out there for MSABC events and to get that awareness raised so they understand the importance and how dollars can actually support underserved as well as those with insurance. It's critical. So right now what we're doing with the money that you raise in the Great West Division, and by the way, over the next 5 years we have a $6 million growth opportunity. With $6 million in Making Strides, we can truly make a bigger impact and get our screening rate up. As I mentioned, our screening rate is 56.1%. The national average is 59.8%. And the top division, New England, and the New England division has a 67.1% screening rate right now. It's amazing. We need to get our division to that level. One thing that's important to mention, in 1993, the New England division in Boston did their first Making Strides Against Breast Cancer event. That event now raises $2 million. From the beginning, the New England division put those dollars that they raised from Making Strides into the initiatives such as advocacy, services for patients, referral for patients, information, again, on mammography. They put their dollars to work immediately, and they significantly got that event up to $2 million. That division has the largest percentage of women getting breast screened. And I guarantee it's because of the initiatives that were started in 1993 through the Making Strides event by funneling millions of dollars into the cause and what was happening there. So it's really important for us as we look at the Great West Division to continue to grow this program. We have a huge burden. Breast screening rates right now on all indicators are not going up anywhere. And overall the screening rates have stalled out. We cannot assume that this disease has enough people working on it. We've got to do our part, and we've got to do it bigger and better than we ever have before. If I look at what our current breast cancer activities and what the dollars you're going to be raising over this year and the next few years support within the Great West Division, it's important to kind of know what's happening. So the money that you raise for Making Strides Against Breast Cancer, the percentage that we send to National, which is about 40%, National puts those dollars to work for breast cancer research, so we truly funnel those dollars into breast cancer research, and it also supports any other breast cancer activity that we do aside from research. So I'm looking at the support from the 1-800 number and the support for the website. If you're not extremely familiar with either of those, a lot of times we talk past those kind of quickly. They're critical players in the fight against breast cancer. If you look at the 1-800 number, one is that provides referral to mammography facilities around where someone might live. They might call in. They might not know their screening guidelines. We also help people work to understand their insurance. Are you covered? Are you not covered? And we also work to help people find, if they do have a diagnosis, the insurance referral program and also the prescription services program helps them also find companies that might help donate some of the prescriptions if they're currently under treatment. So the 1-800 number website are critical when it comes to providing information, referrals, and services to patients across the United States. Also, if you look at what we do in the Great West Division, the dollars that we fund for breast cancer research support primarily a lot of our services for breast cancer patients. So in truly looking at providing services to those women through our patient navigation program, Cancer Resource Network program, cancer resource centers, that's where the information referral is provided one-on-one in many of those cases. It also supports our Reach to Recovery program, which is, of course, a rehabilitative program for women who've undergone breast surgery. Also, the American Cancer Society continues to be a big part of professional education. You might not see it on the ground every day, but we form national partnerships with the American College of Surgeons, and we actually are required to work with those facilities on a national and local basis to make sure that those facilities are giving the correct information out, that they are also providing a certain number of services to underserved women, and they use the American Cancer Society's patient navigation and Cancer Resource Network to make sure that patients get referred to any services that those patients need. Transportation, big piece of what we do as well with our patient program, and also just looking at any of the Cancer Survivor Network where we can hook survivors up with other survivors in other areas so they can share their stories together. I hope this helps you a little bit, one, understand the history. The American Cancer Society has played a critical role in the story of breast cancer. And if it wasn't for the American Cancer Society, we would not be where we are in this nation, even with a 59% average breast screening rate. The Great West Division has a huge opportunity to raise awareness, raise funds, and to save a ton of lives just by focusing on your MSABC event. So I personally want to thank you so much for what you do for the organization. Thank you so much for your work on the Making Strides Against Breast Cancer initiatives. And if you can focus on those corporations, get those teams built, and get those dollars raised, we'll make a big impact in this division. Thank you.